What's going on, guys? It's officially been 2 weeks since I got a hair transplant, and today we're headed back for my 2-week hair transplant update with Dr. Parsa Mohebi. Now, if you missed it, we released a video on the entire process of the hair transplant of all 3 days. We even did a full in-depth access in the procedure room as the surgery was being done on my head. We go over consultation, cost, where I got it done. If you guys haven't given that a watch yet, definitely go check it out. Today, we're going to be going over my 2-week post-procedure update with the doctor. I was able to record our entire conversation and ask him some questions about what I should be looking forward to in the next upcoming months. I'd love if you guys can give this video a huge thumbs up and comment below what you think my hair transplant will look like after it's grown out. Also, if you guys can hit that subscribe button for future updates and more uploads, I would greatly appreciate it, as we're almost at 400,000 subscribers. With that being said, let's get into our 2-week hair transplant follow-up with Dr. Parsa Mohebi.
2 weeks after procedure, any trouble, any issues?
No. Not at all.
Pain, difficulties, swelling? I'm sure you had swelling.
The swelling wasn't too bad, but I did get a little bit of swelling.
Okay, good.
Just only
Eyes
like 2 or
got
3
puffy
days.
a little bit?
Not too bad.
No, really?
No, just nose, face. Oh, I had some temple bruising.
Yeah.
I noticed like a little bit of bruising here.
Yeah, as we discussed before, this is your best time because it's a good preview of the future. So a year from now, if you decide to buzz cut your hair, that's going to be exactly what you're going to get.
Sweet.
Because every single hair that you see will grow and will be right there. For the time being, for the next few months, expect some drop.
Yeah.
You may lose all of them or some of them. Because we do simultaneous extraction and placement, the grafts are not stressed out as much. Used to be in the old method hair transplant, you lose them all and they all grow back after 3 months. But now, 20% of the people will keep some of them or all of them. So if that's the case, you're lucky. If not, don't worry. After 3 months, you start seeing new growth. So basically, 2 weeks from now, if you were to lose them, you can see the final result, what's going to be left. And then after 3 months, you start seeing new growth, but it's going to be baby hair, tiny hair, it becomes thicker and longer over time. Don't expect all to grow at the same time. They're not like grass that grow. They're one here and one there. And gradually you see more darkness of the skin and length to the hair. 8 months, you have good enough hair length that you can start combing and styling it the way you want. Some people, again, if you don't lose it, that time may be 5 months or 6 months. But if you do lose it, at 8 months probably, and still it's not the best time, at 12 months you see full result because hair is long enough so you can comb it and style it the way you want. Have you picked a style for hair?
I think I'll try a couple things. Obviously, just having it hang forward and maybe like a brush back left to right.
I think left to right, as we discussed, will be the best. And I considered that as I was doing this because everything is about strategic placement. So when I was making size, I made sure that left side you have full density and it extends toward the back. So that full density, because we dropped the density on top. But on the left side, I went full density on one side. So if it comb completely from left to right, you still have a nice and solid presentation in front.
How long for the slight redness of the scalp? Do you like the little tint?
Well, your skin is on the lighter side, so you show it a little bit more. So occasionally people may even show some redness until like week 4 or 5, but gradually will get better. Even now, I don't think it's bad.
It looks really good.
It's not
I can't
bad.
really tell now.
No, some people have more than this at this stage. Other complications that you have to be aware of, we talked about before, folliculitis. Some pimples here and there. If you see pimples in recipient area or even donor area, the solution, home remedy, is to just do hot compress, hot water, towel, squeeze it, put it on, keep it for a couple of minutes, redo this every few hours.
Cool.
And then if they're not going away, if they're too close to the hairline, if they're bothering you, come back here, we can incise them. It's a very small, tiny procedure that we do in the office. Sun exposure, what are you going to do?
Cannot go outside for more than 5 minutes.
Well, you can go out.
Sun exposure for more than 5 minutes,
Hat,
I've been wearing a hat outside.
Or sunblock. You can even swim, but put a waterproof sunblock. And if you go in the water, if you do swimming, surfing, you want to keep doing it every 30 minutes.
And then sleep angle, can I go back to normal?
Yeah, you haven't been yet?
No.
Just 5 days?
No.
Okay.
No, I'm fighting.
You've overdone
I'm protecting it, man. I overdone it for sure. I definitely have. I'm not super paranoid, but I was like, okay, I got to make sure I'm not messing this up.
Comfortable with finger and nails, wash it normally?
Yeah, been washing it normally.
You're not baby washing it anymore?
No, I've been getting in there for sure. Still a little numb.
Yeah?
It's like numb and tender. It's almost like, it's weird. It's like I can't feel my finger touching my scalp, if that makes sense.
Yeah.
But you can feel the hair, so it almost feels like it feels like fake hair because you can't feel like the nerve of the hair. I don't know if that makes sense.
No, I get it. So the reason for that is that you know the nerves from this area that run from bottom to top, and from the back that comes from sides and back. So we have thousands of those little incisions. It's like little wounds that are trying to heal. When they're trying to heal, there's some inflammation that goes all the way down to the level of the nerves, and some of these nerves will feel that and they become dysfunctional temporarily. But it will come back. It always comes back to normal. Give it a couple of weeks or months, it will always be back to normal. But some of the swelling may have to do with the type of procedure. Some of it has to do with the patient. People are reacting differently. But the way we do it is also different. The incisions that we use are very small. We use 0.5 millimeter incision for hairline for singles and 0.7 for 2s and 3s. And the reason we can do that is because we use this blunt Mohebi implanter that can go to the smaller incisions, enlarge them, put the grafts, and come back, and grafts will get grabbed. So other places that they don't use this technique, they don't use this type of implanters, they have to make the incision big enough so they can easily, with the forceps, put the grafts into the holes.
And the hole stays bigger.
And hole stays bigger.
And it takes longer to heal.
Holes bigger means more surface area of the wound.
Yeah.
So the more wounding you make on the scalp, the more swelling you can produce. Because all this one, so if the incisions instead of and this is the number that most people do. Most people do like 1.2 for 2s and 3s and 1 for singles. Wow. Exactly, almost twice as much as ours. So imagine the surface area of the wound is going to be bigger, and they cannot dense back as good as we could.
Yeah, because you can't pack hairs
it's just
together.
Like this bigger incision, they cannot touch them to each other.
That makes sense.
So yeah, those are little things that over the years we perfected the system. The whole idea about Mohebi implanter, they invented it, was because it was making us able to be able to implant as we're extracting. But the side effect of it was that we could make the sizes smaller, and we can, dense pack more.
Yeah, that's really cool. Do you have to place hairs around other native hairs and like avoid damage? Like, is it possible to damage grafts?
It's very hard. It's very hard to damage. Well, obviously, when we do loops magnification, and we go between them. We don't go on top of another hair. But even if you go too close to another hair, it's very difficult to damage a hair. And the reason for that, ask people who have facial hair trying to get rid of it. It's almost impossible by just plucking them, putting they do different techniques that they go in and try to burn the follicles, they still grow back. So it's not easy to transect hair or damage hair by going too close to it.
So it's almost like you would almost have to like split an arrow perfectly, kind of idea, and like
even if you do that, I'm not sure that you can
kill the hair.
Kill the hair completely. Shock loss is another option, right? Another thing. It's not about transecting hair, native hair, but it's about just inflammation of healing, stressing the existing hair, and then you lose them. So all the work that you've done before, you may feel like, oh my God, where did they go? That's shock loss. Many of them will grow back. Yeah.
What about the machine? I want to ask the machine that was extracting grafts. It's a machine, right? That goes over the top?
Yes, it's a machine. It's called Trivellini system. The scientific name for this type of machines is multiphasic devices. So multiphasic devices, it means when the punch start extracting the grafts, it goes with different energy in different levels of the skin. So on the very superficial layer, you want to have enough power to cut through the thick layer of the skin. But when you go deeper, we get closer to the follicles, which are very fragile, it's just hanging there, and it's not difficult to cut. It switches, instead of rotation with high speed, it goes to oscillation, very gentle, go down, and doesn't damage any hair, and at the same time, you can remove the entire graft.
Do you have to consider my hair type before diving in? Like if I had a curly hair type, would you be, and how it tucks the graft under, so you're considering that? So how was the withdrawal from my hair, and did you find it to be pretty clean throughout the process?
Yours was a relatively easy extraction. Sometimes we have difficult extraction. Sometimes we have curly hair, we call it C-curl. Underneath the skin, hair turns almost
it cooks,
160 degrees. So you have to kind of follow the same curvature. That makes it a lot more challenging. Sometimes the hair numbers are not, instead of going parallel to each other, they go away from each other, called a splay. So imagine you have like 3 here, each one go to a different direction.
Yeah.
No matter which one you follow, you're going to cut the other 2.
Yeah.
So you have to work with the machine, with the energy of the machine, and change it to make it, bring it from high energy to medium energy and low energy as you go down.
Yeah. But extraction went pretty well. The
It was
extraction,
good.
everything went well.
We were very happy. A lot of, you probably have heard it. The girls were telling you, the group of like 4s and 5s.
Yeah.
Which is not usual.
I'm like really surprised. I feel like the densities, I mean, just even at the buzz cut, it's come along really nicely. And even the healing process of like the donor and what you guys take in, I'm like really happy with how clean everything is. Like it just feels like the healing process on the back end has looked good compared to like some other ones I see where it's like, ooh, that looks rough.
And the cleaning and afterwards, the day one that you come back for hair wash and how you do it at home, that's very important. Let's take some pictures.
Cool, let's do it. Hope you guys enjoyed the video, and we'll be doing more updates soon on the YouTube channel for long form content. I'm also very active on my other socials. I'll link those in the description below. Go ahead and drop me a follow, and if you have any questions, send me a DM, and I'll try to get back to as many of you as I can. And if you made it this far in the video, appreciate y'all so much. Love y'all, stay safe, peace.